because the early symptoms of stomach cancer are similar to those of a wide variety of other diseases. The cancer is typically at an advanced stage when it is first recognized. This makes the diagnosis of stomach cancer more difficult. As a result of this, you must make an appointment with your primary care physician as soon as you can if you develop any symptoms that might indicate stomach cancer. The term advanced denotes that the disease has already metastasized, or spread, to other parts of the body when referring to stomach cancer. When the cancer is initially detected in some people, the disease has already progressed to an advanced stage. After receiving treatment, the cancer has come back in some people and has spread to further organs. When cancer has already moved from the stomach to other parts of the body, the symptoms of advanced stomach cancer can differ depending on which part of the body the disease has reached. The development of stomach cancer is seen to spread to the liver the majority of the time when it is detected to migrate to another organ. In addition to this, it can spread to the lungs, as well as the lymph nodes and the peritoneum, the tissue that lines the abdominal cavity. Indicators in general. A patient may experience a wide array of common symptoms if they are suffering from stomach cancer. Some of these symptoms may become apparent when the disease has progressed to a more severe stage. The following is a list of the symptoms that are experienced most frequently. A reduction of weight for which there is no evident cause. Symptoms include bowel movements that are black and may contain blood, melena, sensations of nausea and vomiting, stomach pain, difficulty swallowing, and exhaustion. Read more to gain a better understanding of the warning signs and symptoms of stomach cancer. Symptoms of cancer that has spread to the liver after having previously been treated elsewhere. You can be experiencing any one of the following symptoms if your cancer has spread to your liver. You may be feeling uncomfortable or even pain on the right side of your abdomen, tummy. Among the symptoms are a decrease in appetite, nausea, and a reduction in body weight. Bloating of the abdominal cavity, medically referred to as ascites. The skin and the whites of the eyes will become yellow if you have jaundice. This is a telltale sign of the condition. Skin that has an itchy itch. The following are examples of symptoms that indicate that the cancer has spread to the lymph nodes. The lymphatic system in the body is made up of a network of lymphatic tubes and glands that collaborate to fight off infections. Lymph nodes are a part of this system and are located throughout the lymphatic system. The following are some of the places that cancer can spread to. The lymph nodes in the abdominal region that are located near one another are referred to as the regional lymph nodes. The lymph nodes that are located in more remote areas of the body, such as those that are located around your collarbone, are known as distant lymph nodes. The lymph nodes in your body that are afflicted by the malignancy are the ones that will influence the symptoms that you will be experiencing. The lymph node will frequently have a feeling of being either hard or swollen, and this is the most common symptom. You may have trouble swallowing if the lymph nodes in your chest have become inflamed. The significant upper abdominal ache that radiates into the back may be one of the symptoms you encounter if you have cancer that has spread to the lymph nodes in the lower portion of your abdomen. You may be suffering from this illness because of this symptom. The following is a list of signs and symptoms that may present themselves if the disease has spread to the tissue that lines your belly, peritoneum. If your cancer has spread to the tissue that lines your abdomen, peritoneum, you may notice that your stomach, abdomen, has gotten larger. This may be a sign that your cancer has spread to another organ. The medical term for the buildup of fluid, which is the root cause of the swelling and is referred to as ascites, describes the condition. Your clothes may start to feel more restrictive as a result of this. It is conceivable that you will experience bloating in your stomach. You might also find it difficult to sit in a position that is comfortable for you or to move around without restriction. It is possible for swelling, which is brought on by the collection of fluid, to be quite a nuisance due to the discomfort it causes. You may also experience different symptoms, such as the following examples: a lack of food and appetite, discomfort in the stomach, including indigestion and constipation, a sensation of having difficulty breathing. Additionally, if cancer has spread to your peritoneum, you may also be experiencing the following symptoms: a blockage in your digestive tract's intestines, which are in charge of digesting, a mass in your stomach. Symptoms that indicate that the disease has spread to a patient's lungs. If your cancer has spread to your lungs, you may experience some or all of the following symptoms: a hacking cough that doesn't seem to go away, and continuous shortness of breath. Recurrent infections that affect the chest area. An accumulation of fluid that takes place between the lung and the chest wall is referred to as a pleural effusion. Getting a grip on the symptoms and bringing them under control. The majority of the time, symptoms can be controlled adequately. Your nurse or doctor will be able to give you information about medicines that will be helpful to you and answer any questions you may have about them. In addition to this, they can give you information about activities that you, your friends, and/or your family can take part in. There are teams dedicated to symptom control in the great majority of cancer care facilities. They can make it easier for you to sustain the best possible level of health for the greatest possible amount of time. They are available at hospices as well as a significant number of general hospitals around the country. The vast majority of symptom control teams provide home care services, allowing its members to make house calls to patients' homes. Unfortunately, there is no cure for cancer once it has reached an advanced stage. On the other hand, treatments like chemotherapy, radiation, or drugs that are specifically aimed at cancer can sometimes help to minimize the symptoms, shrink the tumor, and make you feel better overall. Other operations, such as stent placement or laser therapy, may be utilized to alleviate particular symptoms, such as a blockage in the stomach. When to seek the assistance of a qualified medical expert. The identification of stomach cancer at an earlier stage often results in more favorable treatment outcomes. If your primary care physician has any reason to suspect that you may be suffering from stomach cancer, they must refer you to a specialist as soon as humanly feasible. The majority of cases of stomach cancer, 90 out of every 100, are found in people over the age of 55. This is because stomach cancer is substantially more common in people of advanced age. Indigestion is a condition that affects a very large percentage of the overall population and can be very uncomfortable. Indigestion is a symptom of a more serious condition called gastroesophageal reflux disease, GERD, which can lead to stomach cancer in people under the age of 55. However, if you have persistent vomiting or diarrhea, gastrointestinal issues, or anemia, you should schedule an appointment with your primary care physician as soon as possible. They need to find a specialist to recommend you to as quickly as possible so that you can undergo additional testing. Also, consult your primary care physician if you have trouble swallowing. Because this is not a frequent symptom among people in general, the underlying reason must be determined and investigated. This is the end of today's video. Give your precious feedback in our comment section below. Please like and subscribe to our YouTube channel for more videos.